this lesson, we're going to talk about the characteristics of sinus bradycardia and most common symptoms, some of the possible causes, treatment, and nursing interventions. We're also going to break down each of the steps to learn how to identify it on an EKG. So in sinus bradycardia, the SA node initiates that electrical conduction just like in normal sinus rhythm. The only difference is that it's signaling at a rate of less than 60 beats per minute. But since the SA node still initiates that electrical conduction, it is called a sinus bradycardia. Now let's use the 6-step method to identify the characteristics and identify sinus bradycardia on an EKG. Now, if you have not listened to the normal sinus rhythm lesson, please make sure that you go and check that out because it breaks down each of the steps in detail and it'll help you understand it and apply them to the other lessons that have abnormal rhythms. So let's go ahead and get started. The first thing we need to do is look at our rhythm and determine if we have a regular or irregular rhythm. So we're going to count the small boxes in between the R waves. So from here to here, we have about 29 boxes. And from here to here, we have 29 as well. And from here to here, we have 29. So we're pretty much consistent. So our rhythm is a regular rhythm. And in step number 2, we're going to count our heart rate. So first we got to determine if it's a 6-second strip. The easiest way to do that is to make sure that I have 30 large boxes from the beginning of the strip to the end. So 30 large boxes equals a 6-second strip. So now let's count our R waves. I have 1, 2, 3, 4, 5. So 5 times 10 equals 50 beats per minute. But let's go ahead and also do the 1500 method. So we would get 1500 and divide it by 29, and that gives us 51 beats per minute. So this method is more accurate, especially with abnormal rhythms. So our heart rate is anywhere from 50 to 51 beats per minute. Now let's go ahead and do step number 3. That would be our P to QRS ratio. So do we have a P wave followed by a QRS? P wave, QRS, P wave, QRS, and we do. Every P wave is followed by a QRS. So our P to QRS ratio is 1 to 1. So now let's do step 4. And that would be our PR interval. So let's go ahead and measure right here from the beginning of the P wave to the beginning of the Q wave. And so I have 1, 2, 3, 4, 5 boxes. That would be 0.20 seconds. And that is within the normal parameters. And in step 5, we're going to do the QRS complex. So let's go ahead and just take a look at this one as well. So from the beginning of the Q wave to the end of the S wave, and we have 2 boxes. So that would make it 0.08 seconds. And that is also within the normal parameters. So step 6 would be to identify our rhythm, and we have a sinus bradycardia. So let's recap and break it down and look at the characteristics of sinus bradycardia. The rhythm is a regular rhythm. The heart rate is between 50 to 51 beats per minute. Our P to QRS ratio is 1 to 1. Our PR interval is normal. Our QRS complex is normal. So our rhythm is a sinus bradycardia. But because sinus bradycardia is an abnormal rhythm, it is our job as nurses to find out why our patients are bradycardic and what's going on with them. So let's go ahead and talk about that. Okay, so when you have a patient with bradycardia, the most important thing that you can do is assess your patient. Determine if they are asymptomatic or symptomatic, because that will help determine how to treat them. If they are symptomatic, they will usually complain of syncope, and they will have some dizziness, and they will also tell you that they feel lightheaded. This also causes decreased cardiac output. When they have a decreased cardiac output, they have fatigue, shortness of breath, chest pain, and they usually become very hypotensive. So basically, here's our heart. And the heart pumps blood to the brain, to the lungs, to the body, and then to the heart itself. So whenever the heart is beating at a rate of about 40 beats per minute, it's not contracting as often as it should, so it is sending less blood to these organs that need it. So because of that, cardiac output is decreased. And this is why people complain of being fatigued, short of breath, chest pain. This is why they become hypotensive and they have they're lightheaded. So now that you've determined their signs and symptoms, now we got to find out the cause. Why are they bradycardic? If you can find out the cause of the bradycardia, it's a lot easier to treat them. So let's go ahead and talk about the causes. Some of the most common causes of bradycardia are medications. Think about it. Think about what the most common medications are that would cause bradycardia. And that would be beta blockers or calcium channel blockers. So another major cause would be when patients are taking digoxin or digitalis. So if their dig levels are toxic, they are having dig toxicity. So if you think about what dig does, dig automatically slows down the heart rate to increase the force of contraction. So when a patient is on toxic levels of dig, their bradycardia will significantly increase. So this is one of the major causes of bradycardia. So other causes would be having the vagus nerve stimulated. A perfect example of when this happens is if a patient is trying to bear down to have a bowel movement and they overdo it and they stimulate that vagus nerve. A couple other causes would be SA node malfunction. If the SA node decides to stop working or doesn't work as effectively, then patients are bradycardic. And hyperkalemia. Having high levels of potassium will affect depolarization, which can also slow down the heart. So now let's talk about how we're going to treat the patients that are bradycardic. So the therapeutic management that we got to provide for bradycardic patients is most importantly determine the cause. If you can find out why these patients are bradycardic, then you know how to treat it and what to treat. And if you treat the cause, then the bradycardia will improve. Next thing, you got to find out if they are asymptomatic. If you have a patient who isn't in the heart rate of the 50s, well, that's great. Continue to monitor them. As long as they don't have any symptoms, just watch them. If they do become symptomatic, then we must follow the ACLS guidelines. So we will give them some atropine. Usually we start with 0.05 milligrams of atropine. And basically what that does is try to increase the heart rate. If that doesn't work, then we can go ahead and give them another half a milligram of atropine and hope that our heart rate goes up. If it doesn't, then we have got to prepare our patients for a pacemaker. So we can do 2 temporary pacings, a transcutaneous or a transvenous. So let me show you what those are. Here's my patient. And his heart rate is in the 20s. So I need to emergently pace them. So I'm going to do transcutaneous pacing. I'm going to connect them. Here's my defibrillator. And I'm going to connect my patient to the pacing leads. And I'm going to turn on the defibrillator to the pace mode. And I will usually set it at a heart rate of about 60 to 80 beats per minute. So it's going to send an electrical activity to the transcutaneously to the heart so that the heart will start automatically pacing at whatever rate I set it for. One important thing you got to make sure you understand, if you ever have a patient who is being transcutaneously paced, do not touch them. Because if you touch these patients, you're going to get shocked, because this is sending electricity to the top of their skin to get down to the heart. So don't touch them. Now, another temporary method of pacing a patient would be transvenous. We could get venous access through their femoral vein or through their IJ and stick a catheter with a lead directly onto their heart and then send electrical activity to pace them. So if these two temporary methods don't work, or a patient needs a long-term treatment, then of course they're going to get a permanent pacemaker. So you always got to make sure that you just follow the ACLS guidelines on how to treat the bradycardia. So the key points to remember are the characteristics of sinus bradycardia. They are the same as normal sinus rhythm. The only abnormality is that the heart rate is less than 60 beats per minute. You have got to assess your patient. Find out if they are symptomatic or asymptomatic. And most importantly, determine the cause. If you know why they are bradycardic, then it is so much easier to treat them and you know how to treat them. Find out if they are symptomatic, because if they are symptomatic, we can give them some atropine or prepare them for a temporary or permanent pacemaker. So I hope that you guys have enjoyed this lesson and feel more comfortable being able to identify sinus bradycardia, and most importantly, know the nursing interventions for this abnormal rhythm. Make sure that you guys check out all of the other lessons that are attached to this lesson. All of the other resources that are attached to this lesson, so that you can become more familiar with sinus bradycardia. Now, make sure that you guys go out and be your best selves today. And as always, happy nursing.